Whenever this bacterial species comes into our body shows certain immune response. Okay, it fight and which elect the immune response. So in immune response, there are many cells which is involved. One of the cell is the B cell, isn't it? One of cell is the B cell. You know that B cell is a immune cell which produce the immunoglobulin, or also called as the antibody. Okay, antibody in response of the bacterial or viral antigen. So this is your bacteria. It's a helical rod shape, possesses the single flagellum, have the cell wall, capsule, cell membrane. Yeah. So this is their cell wall. And this is bacterial capsule. How beautifully God created this bacteria, no? And that it is a dangerous for us. It's a dangerous also. But leave it. Now come to the point. Here, this is bacterial cell membrane, and it's a gram-negative bacteria, and its cell wall is made up of by the lipopolysaccharide, made up by the lipopolysaccharide. Now, you may thinking why I am highlighting only the cell wall, the other parts. No, other parts but here the lipopolysaccharide have the significance. Sometimes you are not allowed or you're not supposed to describe everything. Okay, people said you have to take the main thing, isn't it? But you internally that there is a significance of everything. Okay, there is a significance of everything. Nothing is vestigial. No any knowledge is vestigial. Every knowledge has their own, you can say, application. But we have to specific in our fields. We have to specific in our field. So in order to be specific in our field, we have to eliminate many things. We have to eliminate many things, and that's fine. Okay, no problem. Okay, fine, come. So this is a lipopolysaccharide, and you have the nerve, a neuron. Neuron consists of the cell body along with the dendrites, along with the long extension called as the axon, which have the axonal terminal. And nerves are protected by one sheath, and that sheath is called as the myelin sheath. And in between the two successive myelin sheath, there is a gap, and that gap is called as the node of Ranvier. Fine. So this is a myelinated neuron. Now, and don't forget, these extensions are the dendrites, which help in collecting the nerve impulses. Fine, no problem. Now, there are many proteins which is present in the myelinated neurons, but one of the protein is the glycosides. Okay, one of the protein is the glycosides. Clear? No problem? Now, whenever a bacteria comes in our body, it secretes certain antigen. So for destroying this antigen, our B cell secrete the antibody. B cell secrete the antibody. This is a structure of antibody. Okay, and this antibody, they will fit over these lipopolysaccharide membrane. Remember, in the case of this C. jejuni or Campylobacter jejuni, The antigen, this whole body is antigenic. Its flagella is antigenic, its cell membrane is antigenic, its capsule is antigenic. Got it? But their cell membrane, which is made up of by the lipopolysaccharide, it's a more potent antigen. It's a more potent antigen which is present in the Campylobacter jejuni. So this antibody, which is you can say sensitized in response of this lipopolysaccharide, and it's bind over this lipopolysaccharide. Clear? Now, this lipopolysaccharide, it's mimic the glycosides. It's mimic the glycoside. It means the structure of lipopolysaccharide and the structure of the glycoside is, you can say, much more similar. So if these two structures are similar, it means the antibody which is directed against these lipopolysaccharides can also direct against these glycosides. Yeah, once again, B cells secrete antibody or immunoglobulin in response of this lipopolysaccharide, and the lipopolysaccharide structure and the glycoside structure is much more similar. Fine? So it's quite possible that the antibody which is directed against these lipopolysaccharides can also be directed against this glycoside. And you know, if it's directed against their own glycosides, their own cell, result into the autoimmune condition. So basically what happened when this antibody goes to the myelin sheath and they start binding with these glycosides, okay, this glycoside result into the demyelination, okay, result into the destruction or demyelination of the nerve. Demyelination means destruction of the myelin sheath, and you know, if there is a destruction in the myelin sheath, then there is a poor nerve conduction. So one of the function of the myelinated neuron, okay, is that the myelinated neurons conduct the nerve impulse faster as compared to the non-myelinated neurons or non-myelinated nerves. Clear? No problem? Fine. So if I start demyelinating the neuron, okay, result into the weakness of the muscle first of all. This is a weakness of muscle, okay, and there will be a ascending paralysis, okay. Apart from that, it also affects certain cranial nerves, like the 7th cranial nerve called as the facial nerve. Okay, you know that we have a 12 pair of cranial nerve. The 7th pair is of the facial nerve, and 5th nerve is a trigeminal nerve. Okay, so trigeminal nerve, 5th nerve, and your vagus nerve, these all are affected. And you know, if vagus nerve affected, then there will be a certain cardiac abnormalities. Okay, cardiac dysarrhythmias. There is a problem in the conduction system of heart. Got it? No problem. So these are certain signs and symptoms. And now this antibody has one specific name. Okay, this antibody has one specific name called as GD1, anti-GD1 antibody. Yeah, anti-GD1A antibody. You write it down, it can be asked in the MCQ. This antibody is called as the anti-GD1A. Okay, and there are other variants of these antibodies. Certain antibodies only bind with the node of Ranvier, certain antibody bind with the, you can say, the axon. Fine. So this is a variant, but you should remember one antibody at least, and that is called as the anti-GD1A antibody. Anti-GD1A antibody. Clear it? No problem. Understood the simple pathogenesis of the disease? Yeah. Now, once you understand this, okay, let's move ahead and discuss how you can manage this Guillain-Barré syndrome. How you can manage the Guillain-Barré syndrome. And you know the diagnostic evaluation we already discussed. Then we have to check the CSF, Okay, CSF will show the normal number of leukocyte, and there is a elevation in the protein amount. There is elevation in the protein amount, and that is called as the albuminocytologic dissociation. Albuminocytologic dissociation. Clear it? No problems. And the myography, you can say the myography also reveal that is the Guillain-Barré syndrome. And this is like generally you have any bacterial infections or campylobacterial infection, and you have certain diarrhea. Fine, you have the diarrhea as a manifestation of Campylobacter jejuni. You have diarrhea, fine, and maybe you have the weakness in entire body, not only in the limbs, weakness in the entire body, and you taken certain antibiotics called like the erythromycin, okay, and you recovered, fine. And now in evening, you start suddenly the weakness in the muscles, you lose the sensation in the muscles, and they're starting the paralysis. Then the immediate diagnosis will be the Guillain-Barré syndrome. Got it? No problem. Now, coming to their treatment, their treatment is to administration of certain intravenous immunoglobulin. Okay, write it down. If we talked about the treatment, and there is no any specific treatment, but the two ways to treat the Guillain-Barré syndrome patient. One is called as IV immunoglobulins. Okay, and another thing is called as the plasma exchange. And occasionally in certain cases, in certain research shows that the corticosteroids is also effective to manage this Guillain-Barré syndrome. Corticosteroids. So these are the three things. Now, in IV immunoglobulin, what we did, we generally taking the certain immunoglobulins, okay, and we administered patient intravenously. Now, the underlying mechanism, how it's helped this Guillain-Barré patient to bounce back, to recover, is not clear-cut, but it's believed that these immunoglobulins will, you can say, modulate the immune system of this Guillain-Barré person, a Guillain-Barré affected person. Okay, it's modulate the function. It means managing their immune system. Now, the plasma exchange is a procedure. Okay, it's a procedure in which you can say there is a complete draining out of the blood from the patient, and there is a separation of plasma. Okay, there is a separation of plasma because plasma contains the affected antibodies. This anti-GD1A antibody. Okay, so you discarded the anti-GD1A antibody, and then again the blood cells are transferred to the patient body. Okay, and this technique is also known as plasmapheresis. Write it down. This plasma exchange, it is also called as plasmapheresis. Plasmapheresis. Got it? Plasmapheresis. No problem? Clear? Fine. So, this is about the Guillain-Barré syndrome and how it is related with the Campylobacter jejuni. Got it? No problem? So, let's summarize today's lecture. We studied about the last bacterium of which causes the discomfort in the gastrointestinal tract, and it is called as the Campylobacter species. Now, the genes Campylobacter comprises with the two notable species. The one is called Campylobacter jejuni, another one is called Campylobacter coli. And among these two, the dominant one is the Campylobacter jejuni. Now, this Campylobacter jejuni, they are mainly causing the diarrhea. They are mainly causing the diarrhea, and occasionally it results into the inflammation of gastric mucosa called as the gastritis, okay? And sometimes when this is spread to the blood causes the bacteremia, and that bacteremia can be a recurrent, a transient, or it can be the chronic. Got it? No problem. Now, then we studied about the characteristics of Campylobacter, that it's a gram-negative, okay? Basically resemble the shape of Vibrio, okay, Vibrio cholerae, and they are a microaerophilic, okay? And you can culture this bacteria on the blood, agar. Got it? Fine, no problem. About their antigenicity, their entire body is antigenic. Their capsule is antigenic. Their flagella, a single flagellum is present, which is the antigenic, and their cell wall is antigenic. Their cell membrane is antigenic. Now, their cell membrane have the great clinical importance. The great clinical importance is their cell membrane, you can say, mimic our own nerve protein called as the glycoside, which is present on the myelinated neurons, okay, myelinated neurons. And that's why the Guillain-Barré Syndrome autoimmune condition is linked with the Campylobacter species. This Guillain-Barré Syndrome is a post-infectious, okay, immune-mediated neuropathy, okay, characterized by the weakness of the muscles, and there is ascending paralysis of the muscles. Now, the management goes with administration of IV immunoglobulins. Apart from that, there is a plasma exchange, also called as the plasmapheresis, and there is a administration of corticosteroids. Clear? And yeah, there is a good prognosis. In 80% of the cases, patient recover. There is a significant ambulation. But in 20% cases, there is a sudden death. If there is a involvement of respiratory muscles, okay, paralysis, then there is a sudden death. And remember, that's the acute condition. Got it? So thank you for having me. Bye. Have a nice day.